Well, I'm enjoying the very distinct pleasure today of having a conversation with Dr. Jane Somerville, cardiologist from London, England. Much of what we've talked about in the course of events has involved the innovations in the early years of cardiac surgery, particularly surgery for congenital heart defects. And not surprisingly, we've had the opportunity to speak with a number of surgeons, and equally not surprisingly, we've learned of innovations that are attributed to many of the early surgeons. It goes without saying that in the treatment of congenital heart disease, there's a unique and important partnership between cardiologists and surgeons. And I hope that Dr. Somerville will be able to share with us some of that unique perspective. In London, dating back to the early 1940s, there are surgeons with names like Sir Russell Brock, Sir Thomas Holmes Sellers, Sir Donald Ross, Sir Magdi Yaqub, and countless others associated with very fundamental and important innovations in congenital heart surgery. And I think that we are enjoying the privilege of being with someone who experienced, participated in, and has unique perspectives on much of that history. Dr. Somerville, if you would, discuss a little bit with us the early days of heart surgery and the collaboration between the cardiologist and the surgeon.
Well, I saw it from the perspective, which I'm going to speak about, from the 50s when I was a house surgeon to Sir Russell Brock, as he was then. And I did that for a year. And then I know all those people very well that you mentioned. I think that there wasn't a lot of collaboration in the early days, certainly in the UK, with surgeon and physician. The cardiac surgeons usually receive patients, or often receive patients with the wrong diagnosis. And they did not regard the cardiologists with much admiration or respect. And they had to plow their own furrows for quite a long time. And of course, this was long before pediatric cardiology developed. And I think really in the UK, excellent cooperation between surgeon and physician in pediatric cardiology came from Great Ormond Street with David Waterston and Dick Bonham Carter, who really did cooperate well and share each other's problems. Now, in the early days, in the late 50s, when I was a house surgeon, that's the lowest of the low, junior assistant who stood at the end of the queue of all the admiring future trainees. When I was there was no ITU. The diagnosis was often wrong. And operations were extremely long. So, you know, going on all day. We did just have the bubble oxygenator, and we did have hypothermia, and we did have sort of smash and grab surgery. And it was all a bit of a nightmare, looking like a battlefield as far as I could see. That was then, but innovations were made, and it's not surprising that Brock was keen on the pulmonary valvotomy because he wanted something that was more direct and effective than making suture lines. So from that point of view, there were a lot of innovations, there were a lot of discoveries, knowledge of anatomy and errors and how to do things properly entirely came from the pathologists. And I must say I thought in guise that the cardiologists were rather airy-fairy about what was going on in the operating theatre. In fact, one cardiologist came in one day and asked Brock, he said, "Do you know your house surgeon isn't wearing boots?" I mean, as if that's what he needed to know. But anyway, you know, it was quite horrendous, but there were successes. And there were things going on around the world from which we knew and benefited, and things moved very quickly.